order the HHS meeting, 9:30. Roll call, please.
Okay, Chair Renahan.
Here.
Vice Chair Swarzy.
Here.
Member Selman.
Here.
Member Jeff.
Here.
Member Desar.
Here.
Member LaPlante.
Great. Do we have any public comment?
No public comment.
No public comment. Nothing from me. I'll take a motion to approve the minutes of Tuesday, September 21st.
Second.
Questions, additions, all in favor?
Aye.
Any opposed? Those pass. Take a motion on HHSP 321 recommendation for respect to wall station renewal of annual homeless management information system, software and cloud services, November 1st, 2021 through October 31st, 2022, not to exceed $35,150. Motion and a second. Questions or comments? All in favor?
Aye.
Any opposed? Passes. Take a motion on HHS R 44721 resolution approval for first modification of CDBG replacement of $48,086.55, increasing the funding for a total of $548,8655. All right. Questions, comments?
Yeah, I had a question about, why is this on the agenda twice? So what's the difference between this item, 7A and 8A?
So one of them is the community development grant, and the
Okay,
other is the contract that the center has for
the
the
actual,
actual work.
okay, gotcha. And I understood the grant covered 100% of this, and then that is what it works. All right, thank you.
Funding. So, okay. Any other questions? All in favor? Any opposed? Passes. Approval for first modification CDBG with United Cerebral Palsy Segment of Greater Chicago, where the hardest group and priority 1, increasing funding by $53,145. We have a motion, we have a second.
Yep, second.
Questions, comments? All in favor?
Aye.
Any opposed? That passes. Care Center, we have take a motion to approve HHSP 38821 AMS mechanical systems for steam generator replacement period through November 30th, 2022, not to exceed $548,080.55 for lowest, most responsible bidder.
Second.
Questions, comments? All in favor?
Aye.
Any opposed? That passes. Take a motion on change order FIP 4A20 issued to Rock, Cusco, and Connolly to provide consultation services related to collective bargaining for labor negotiations December 1st, 2020 to November 30th, 2021, increasing encumbrance $40,000.
So moved.
Second.
Questions, comments?
I just want to comment, I'm going to be a no on this, just because they've given thousands and thousands of dollars to one party since May of 2021. And for free speech, they have a right to do that, but for my free speech, I have a right to vote no.
Okay, any other questions, comments? All right, all in favor?
Aye.
Any opposed?
Nay.
Thank you. That is approved. Take a motion to approve authorization for overnight travel, weatherization assessor to attend energy auditor training in Champaign, October 24th through October 29th, 2021. Expenses to include blah, 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 for approximate total of $1,850, Wex grant.
Second.
All right, all in favor?
Aye.
Any opposed? That's approved. Take a motion to approve consent item, extending contract with Clairvoyant for business out analysis and nursing clinical functions through November 30th, 2022.
Second.
Second, questions or comments? All right, all in favor?
Aye.
Any opposed? Approved. All right, we do have residency waivers today.
One, yes.
So has everybody had an opportunity to take a look at the residency waiver?
I'll move to accept.
I'll second.
Okay. We have a motion, we have a second. Any questions or comments?
If this, as long as we have the availability, I'm okay.
Okay, Janelle, can you confirm?
Yes, Anita can speak to the availability, but yes, we certainly do, because keep in mind, we've not been able to take admissions for very limited basis throughout this pandemic. So yes, we do have availability.
Thanks,
Yeah,
Janelle.
I think we're happy to fill more beds if we can. So, all in favor?
Aye.
Any opposed? All right, that is approved. And Janelle, please take it away on DuPage.
Absolutely. So unfortunately, we've had a little bit of an uptick of COVID cases. We've had to restart our full COVID unit. In the past 2 weeks or so, we've have 20 residents that are positive, 4 staff. There does not seem to be a correlation between the staff and the residents. It seems to be a resident to resident. And when we look at the incubation period, there was a period of time where residents were still seeing having visits and going about the unit. And so part of it is related to that. The other, we're just trying to work with our infection preventionists. So we have an infection preventionist consultant that we're working with, and they're helping guide us. In addition, of course, to the health department, that's been a great resource for us, as well as yesterday, we had a conference call with the Illinois Department of Public Health infection prevention consultant. We're just trying to figure out the mode and make sure that we're doing everything possible, because this variant is extremely, we know how contagious it is. Annabelle, our director of nursing, has done a phenomenal job with testing. We use a combination of PCR test, which is the lab test that gets sent off and we get results within 24 to 48 hours. She's also doing rapids. So there's times where she's doing some testing in the AM and the PM. We have residents that might be flushed, but they're negative on the PCR. We'll run them again in the afternoon and they're positive. So she's being very assertive. We work very closely with our medical director to put each resident that's positive on a regime of vitamins and blood thinner and antibiotic. So we're extremely fortunate that we don't have anyone with very, very significant symptoms. It tends to be the runny nose, sore throat. We do have some starting to come off the COVID unit that started this. Our goal is to catch it and try to prevent it as much as possible. So obviously our big focus is massive audits of how you're putting your PPE on, how you're taking your PPE off. It's a very concise process. What are we doing for hand washing? We're auditing the hand washing all the time. The staff are just tired of it. Everyone's tired. So that's where we're at with that. Before I move on to one other thing, does anyone have any questions?
Member LaPlante?
Thank you, Janelle. Can you please tell us how many of the staff and the residents were fully vaccinated? And if these
So
are
of the
breakouts by
24 total, 2 were unvaccinated, 2 staff.
So 24 total, only 2 staff members were unvaccinated.
Correct. And keep in mind, our staff members if we weren't in an outbreak, those staff members would still be tested weekly. Because we've been in an outbreak, and an outbreak is 1 case, our staff are being tested every 3 to 7 days. Our residents are being tested every 3 to 7 and more than. So we're certainly doing a lot of testing just to try and catch it early.
Can I get a follow-up?
But the others had their full vaccinations. Is that correct? Not just
That
one?
is correct. And I have reached out to providers such as Walgreens and Omnicare to try and get the Pfizer booster, because our residents and staff were Pfizer. So we're starting to have that discussion. It's really hard to get them to respond, so I'm pushing it as much as possible.
Can I ask, why is it, I mean, they shouldn't this be like one of the first groups that they're offering a booster to? What do you think is the holdup?
You know, when if you don't, I mean, many might remember last spring when we were trying to get Omnicare in, we were to select a vendor through public health, and we did. And it took, I mean, I even had Karen from the health department trying to push. I mean, it's just their organizational structure. So we hear Walgreens is a little easier to work with. So I submitted everything to them over the weekend, and then I'll just start doing some follow-up calls. But this is, you really got to advocate for yourself. And that's what we're doing.
Thanks, Janelle.
Quick question. So when you spoke to Karen Al, is she not able to help you through the health department to bring vaccines over to the care center?
You know, that's not been the case because of the volume, but certainly that is something we talked with Adam, and he's part of our conversation yesterday with the Illinois Department of Public Health, that we will see if they can assist us. But generally in the past, they were not able to, because we're talking about 400 staff and, 250 residents.
Okay.
And I have one other thing I wanted to mention. In and amongst all this, there's like 15 other major projects going on in relation to a multitude of topics. But what I did want to mention is we have had Carevoyant, was our electronic medical record for, I can't mention how many years, 8 years maybe. It's a terrible system. It's been very difficult for the staff, very time consuming for the staff. And so we finally got permission to move forward, and with PointClick Care, it's a very easy, friendly user process. It will help the staff's time and labor that it takes to just enter all the necessary data. It also works well with other systems. So we're very, very excited. We had to put this off because of outbreaks, but we did a go live. Shauna Berman, our assistant administrator, is the lead on that. And we did a go live in the middle of all of this October 1st, just because we couldn't put it off any longer. So we're very excited that we'll be moving to a much more friendly system. So thank you all for that.
Member Stark?
Thank you, Janelle. I just want to go back to Member LaPlante's question for a second. You said the
Yes.
four staff members, 2 were fully vaccinated, 2 were not, but you didn't mention the residents, the 20.
All the residents were vaccinated.
All the residents are fully vaccinated. Gotcha. I just wanted
Those
to be
20
clear on
were,
that.
yes. Yes,
Thank
they
you so
were.
much.
Janelle, I was just wondering, can you tell the committee, how are the residents doing in terms of morale? I mean, here they've been through a lot over the past, year and a half, and here we're pushing them back into the
Yeah.
works again.
Yeah,
How's it- and staff too.
It's really difficult for the staff as well. So we, the residents have a really hard time being moved and going through that isolation. Some of them have been down there before to our COVID unit. Some enjoy the COVID unit just because of the attention that they get, but because we also have cameras and we have continuous pulse oximeters. So there's a lot of medical oversight occurring. But generally, no, they don't care for it, and it is hard. They did have, quite a period of time where we're open for visits, and we have many that were going out even against our advice. We can't stop them, but families were taking them out to appointments and whatnot, and that could very likely be how it was introduced as well. We will never know for sure. So they were getting that break, but yes, it's unfortunate that they're having to go back. Even if they refuse, I have to physically, I haven't, we've been but we have to remove the risk to those that are positive.
Thank you. Member LaPlante?
Can you please, Janelle, let us know how many of the staff members are still unvaccinated at this point?
I can give it to you in a percentage. So we're about 86% of our staff vaccinated and a little over 94% of our residents. So our numbers are good in regards to that. But we're not at 100%, obviously, but we're much higher than the industry. Down in Southern Illinois, I had a conversation with Illinois Department of Public Health, and he's saying the percentage is less than 40. So in skilled nursing for staff.
Great, thank you. You said you have another, something to address with us?
Just the medical record. I just want to share that with you all.
Okay,
That was it.
all right, great. Well, thank you. Thank you for your report. Oh, I'm sorry.
Thanks, and Janelle, thank you. I know it's tough over there with you and your staff. I mean, this has just been lingering on so long, and I know I have friends and family that are healthcare workers, and I know it's been a very stressful time. So just make sure that everybody at the Convalescent Center knows we appreciate everything that they're doing.
I will do that. Thank
Important
you.
message to let them know.
Yes. I appreciate that. Thank you so much.
Thank you, Janelle. We'll let you go now and on to community services update. Mary Keating.
Thank you. One item before we move on to the next agenda item. Last week, we had a really good meeting over at the courthouse with Suzanne Armstrong, Kimberly Harris, and Elizabeth Fortino, and our new case manager who will be assigned to eviction. A chance to talk with Judge Koski. They've given us great space. We have basically a conference room right outside the eviction court. They're actually going to set up an area table so the case manager can actually sit in court. We're very excited about the partnership that we're developing with the 18th Circuit. So onward and upward. As of last week, as of the 27th, IDA had distributed just $20 million of our ARPA funds. So we are well within the 65%. There was, the federal requirement was that 65% of the funds be obligated by December 30th. So we were at 72% on the 27th. So we're well, we've easily met the deadline, and actually IDA, the state of Illinois has reached out to the federal government asking for additional funds because Illinois is doing exceptionally well compared to other states. So
Exceptionally not well.
the other states are doing exceptionally not well.
You know what I'm saying? Because we have such need. That's what I'm-
Well, I think the need is the same across the country. It's that some states just have not ramped up their
Good to hear.
allocate or their processes.
And, very great call on putting it through the, Illinois Department of Health, great. That was a really good,
I'm extremely relieved that we
Yes,
did not
I'm
try to
very-
do this on our own.
yes, excellent call.
Yeah, and I have to say the IDA staff that we've worked with have been exceptional. Kristen Faust, the executive director, just has put together a tremendous team. There's a couple of people who, and in fact, the person who's running the court-based eviction diversion program, he couldn't have been more helpful. We had a call with him. I think it was right before the last HHS meeting, because I think that I talked about it at the last HHS meeting. So yeah, we're really pleased with the partnership we've developed with them. They've done a great job.
And what hours, do we have somebody over there like all through the mornings or certain mornings only?
She'll be there during during the eviction court call.
Okay, so I would, say anybody, if you want to go to the court, just take a look at how this is all. And I think it would be very interesting and, just informative for our committee to see what's been going on with the great work.
Most of the calls are on Zoom. The majority are on Zoom, but
But you might just want to see, get a chance to go over to the court. Probably don't go very often. So.
if you can help it.
Anything else, Barry?
No, not an update.
All right, and then with that, we're going to move on to, since
Can
we,
I ask a question?
oh, yes, please.
So Mary, if most of the calls are on Zoom, the court calls are on Zoom, how can you said the person who's helping people get services
Right.
has a place in the courtroom.
Right.
So understand how
Well, she'll also, we're working on her being able to be in a Zoom breakout room.
Oh,
That's what the judge already has the ability to people breakout room in Prairie State. And hopefully we'll have that same technology to talk to our case manager as well.
interesting. Okay, thank
So,
you.
it's a work in progress, but
Yeah,
that's the
right.
plan, is that Zoom breakout room.
Thank you.
All right, and with that, we knew we were going to have some extra time today, so we scheduled to start to have a little bit of discussion on what we anticipate to be, Mary's put out a request for $10.6 million for community services. We'll see as a county board vote upcoming. As we know, through CARES and federal and state programs, community services, an increase in grants, 74% or something like that, or over $91 million.
$93 million.
$93 million. So obviously looking at some capacity concerns, some pressures on community service to administer all this additional funding flowing through. So there's been discussion on how most effectively to distribute the community services bucket with our nonprofit partners. And keeping in mind an objective, I think, Mary, that you laid out that I share is to identify unmet needs and gaps in service, avoid duplication, and to really make a big impact versus many small paper cut type impacts. So with that, I'm going to turn it over to Mary for next steps on maybe how to administer some ideas
Right.
here.
Thank you. So, yeah, we kind of had a brief discussion at the end of the last HHS meeting about the potential grant program to be run with ARPA funds. As I said at the last spreadsheet that Nick presented, there was 2 million. That was sort of my impression of, if you needed to scale it back, that I thought if you were going to do anything, you should do a minimum of 2 million. My personal belief is it should be 10 million. It should be basically $2 million over the full 5-year period of the ARPA grant. As Chair Renahan said, and I think I've kind of beaten the drum to death on this one. Our internal staffing capacity is extremely challenged. And so to me, the most efficient and logical way to administer a program like this would be to partner with a community agency that does similar work. And here in DuPage, that's the DuPage Foundation. They are a long-running community foundation serving exclusively DuPage County. We work in concert with them quite a bit. We have Barb Stepaniak, who's their program director. She and I serve on pretty much every board I'm on. Barb is on it as well. Every task force that I'm on, Barb is on it as well. And so we have very similar processes. Obviously we have very similar goals, and I have, it would be my recommendation that we partner with DuPage Foundation to administer these funds.
So Mary, would it kind of be like, would we send all the money to DuPage Foundation and kind of have them administer, kind of like the Illinois Department of Housing did? Is it some similar to that?
Yeah, that's actually a pretty good analogy. I think similar to how we partnered with IDA. I think the difference would be we had some input for IDA, but it was really their show.
Okay.
I would propose it be much more of a partnership where we're working, almost hand in hand, where someone from the county, either myself, Chair Renahan, someone that the chairman designates, that someone from the county would be really heavily involved in the decision-making process, that the board would be fully involved and fully aware of, and also that upfront the board would make decisions as to what are the kinds of things what are the priorities of the organization. So yeah, I wouldn't see this as sort of a contract for service. I would see this really as a partnership,
Okay,
so that the board is completely involved. Obviously, DuPage Foundation couldn't do this for free. And so the $600,000 would represent a 6% administrative fee over the life of 5 years. Now, when you look at that number as sort of a standalone number, it is, it's a significant amount of money. But I think my expectation would be, and I think this would be the board's preference, would be that there is a competitive vetting process. There's ongoing monitoring. There's some sort of reporting requirement. It's either quarterly, semi-annual, annual. So this isn't a one and done, give the checks to the agencies and we're all done. This is a long-term program that would require, and that frankly, that's why we don't have the capacity to do it internally. The board just wanted to select 6 agencies and write them a check and have no further obligation. We could probably handle that, but something that really would be impactful, that would be, like I said, that would require some evaluation, some monitoring, and some reporting, I think, is sort of beyond our current scope.
Vice Chair Skorski.
Yeah, so I'm on board with this. The question I have is, the partnership sounds great, but we talked last meeting about maybe possibly earmarking these ARPA funds for maybe 1 or 2, initiatives that we can really hit hard on. So we're making those decisions, and they would have to follow through on how that money is spent. So I just want to make sure that we're on the same page with that.
Yeah, I think
they're not going to make the decisions on where this money goes. We're going to make that decision. Is that?
Well, so I think it's kind of a 2-step process. I think the first thing that the board would want to do is identify what are the priorities. Food assistance is probably that's an obvious one. Housing stability, housing affordability, substance abuse, mental health treatment, the things that really were absolutely became so apparent what the needs are out in the community through the pandemic. Because ultimately these funds are for response and recovery. And so it does have to be addressing the needs that really became prominent over the last 18 months. So the first step would be that the board would need to make some decisions about, and frankly, that's difficult work to say, this is what we're going, because if we really want to be impactful, we're not going to fund everything under the sun. We're going to say, these are the highest priorities, which means other things may not get addressed. So the first step is the prioritization. And then the next step, which is really where the foundation would come in, would be who are the best organizations to, who has the best plans?
So that would be the
with this.
partnership
That would-
portion of it, so to
Right.
speak. So, and then, thank you very much for that. And then, the money that they would be getting, so if it's a 10 million, it's $600,000, if it's 2 million, it's 120,000. They use that money, they use their funds for charitable causes anyway, correct?
Yes,
So that if we gave them $600,000 to distribute, help us distribute $10 million, that $600,000 is still going to what worthy causes and so forth.
it would go to, frankly, it would go towards the administration. It would go towards staffing.
Okay.
You know, if there's a particular software that they need in order to stand up,
So
you know,
it's-
large
it's
scale.
Pay for the services.
Yeah,
Okay, I got you.
Yeah,
I got you.
yeah, it's similar to, all of the funds that we get in, you know, my salary is paid by grants, most of my staff, their salaries are paid by grants. Some of the light bills.
And in your
are paid by grants.
opinion, you know, this makes more sense as opposed to hiring more people for your department.
Well, because the challenge is that there aren't people out there.
Okay.
Frankly, if we could, you know, if we could find people who had significant experience, not only just understanding how to run a grant program, but also having the knowledge of the sort of who the players are in the DuPage community. Those people either work for us or they work for DuPage Foundation.
Okay.
Frankly, they're not, you know, we're constantly challenged with finding people with grants experience and certainly local grant
Thank you
experience.
very much.
Member, sorry, your hand up.
Yeah, I did. Mary, I'm sure you're familiar with this from the
Mhm.
Meyer. Where does the $600,000 come from? What line item is this? Because I see for community service, there's only $320,000 ask for capital
Is it, I
improvements.
think it's at the bottom, I don't have that spreadsheet.
It's in the
It's in there,
bottom
it's
half.
in there somewhere, it might be in the bottom half.
Wouldn't
Yeah,
it just be
I-
part of the $10 million?
It would be 10.6.
Yeah, it was in there.
It would be
Yeah, it was in
10.6.
our,
It was-
it
Oh.
was in the presentation that
Yeah.
Mary requested. August 10th, 2021.
While you're looking for that, correct.
Yeah.
So, yeah, so this is kind of what appears to be to me a really good partnership with a private organization and a public organization. And it seems like they have all the tools necessary to do this. They do it, this is what they do.
This is what they do, right?
This is what they do, so it's, you know, it makes complete sense.
Right.
Yeah.
Yeah, DuPage Foundation already provides
Yes, they do a lot.
private grants
Yep.
to many of the same organizations that we work.
Okay, so I see down here $15 million. I just feel like the goal line keeps changing for all departments, not just this one. It says.
This has been pretty
Yeah, this
consistent,
has
this
been-
10.6.
Community-
I've got a lot of numbers.
County Community
Numbers on
Service Program / nonprofit, 15 million.
That's because that included money for pads.
The 2 million per pads.
This request has been the same since June. I'm kind of, what do you need from us? Do we need to say, yes, let's get this on the finance agenda at 10? What's the next step here?
Well, I think, yeah, I mean, I think.
Well, it hasn't been approved yet through finance to actually allocate the 10.6 to begin,
That's what
or
I'm saying,
or
right.
2 or whatever. And I do appreciate you had brought up the 10, and I did talk with finance as well, kind of pushing, asking for the 10 versus the 2, so we can have a longer, you know, horizon on it. So,
Yeah, yeah,
but
and I
in
think,
terms of like first we'd have to go through finance to get the money to begin with, and then, you know, I just thought since we had some time, Mary, this was Mary's idea. I gotta say, when I first heard it, I kind of felt like they were taking our responsibility, giving it away. But as I understand capacity issues, you know, and I'm convinced this is the right thing, so.
I just want to move it along. I know we've had a lot of ARPA discussion, but I thought we were waiting on a special call, which hasn't been scheduled. So when are we?
We're having a
talking
special
about
call
that?
later this month.
Oh, okay.
Yeah.
So
This is on that agenda then?
I'm not sure, we have to talk with Nick to when we're gonna, but
Or not.
hopefully if this committee wants us to put it on
Yeah,
finance, then we can.
I would.
Yeah, you know, we had some time, so I wanted to make sure that, let's make sure everybody's saying, I'm not hearing information, I'm trying to provide as much as we can services as to ideas. So is everybody feeling good about this plan?
Yeah.
Remember the plan? Yes. Yeah. Okay, I didn't see her. Didn't see the nodding.
Can we try to get it as well then? We did do some, like that's my frustration, and it's not to you, it's that we're doing a little bit of ARPA and then we're saying, but we're gonna wait, and that's not the purpose of these funds. Like if we can get this on the 12th, I would. I don't want to wait until end of the month or November.
Yeah, what I would ask is that if we can, and I'm not sure what the formal appropriation process is, but if it could be appropriated for this purpose, then we can come back with an agreement there's no way I could get an agreement with the DuPage Foundation on the agenda by next, prepared and on the agenda by next Tuesday. But I think if we get the commitment of the funding
Right.
through finance, then we can really sit down with DuPage Foundation and say, and work out exactly how this is gonna work.
So maybe that's our next step, to circle with Member Chaplin to see if we can get it on the appropriation part at
Yeah,
least.
that's ongoing. It's kind of also finances, everybody's got moving parts, we all know. So, but I think this is non-controversial, so
Yeah, no, I know, that's what we can get.
Yeah, but to answer your question, I believe that is the next step. Finance has to commit
Appropriate.
the funding.
Okay.
And then we can, hopefully 2 weeks, maybe 2 weeks after that.
Well, thanks everyone for listening. Thank you, Mary. Sure. And we have the old business. Is there any new business? All right, I'll take a motion to adjourn.
Second.
All in favor? We're adjourned. Thank you.